Hello, and in this video I'm going to be answering some of the questions you put to me at the end of the webinar that we did with Practice Index. I'm going to go through a few based on theme, and we're going to start with some questions around the reception team. So first of all, do we have reception managers or a senior receptionist? Wondering how we manage the non-clinical complex queries or complaints at the front desk or via the phone. So we do have a reception manager, and we also have senior receptionists who run the team at any one time. We have about between 4 and 5 receptionists answering phones at any one time or on the front desk. And that depends a little bit on the time of week. So we know that on a Monday we're going to be very busy, so we tend to roster more people on at that point. They are all able to deal with the administration tasks and booking into nursing appointments, so they don't need to speak to the clinician to manage those calls in particular. They're very well trained, and they all have the senior receptionist on that particular shift, and then there's a reception manager who is also there, both of whom are able to help deal with any problems, for example, that might come up when a patient might feel they want to speak to someone senior because they've got something that's upset them, and they will very rapidly step in and help out if a patient is not happy with the service they're getting from the receptionist they're speaking to. Next question was, does this reduce the skill set of the reception team from a care navigation perspective? And I think this is probably asking, does the clinician-led total triage de-skill the reception team? Well, I'd actually argue that it's done the opposite of that, because all of the receptionists are getting one-to-one discussions with the clinician every time they have a clinical phone call answered. They will go through the case with the clinician will rapidly point them in the direction of the best place for that person to be seen. We often find at this point that, having done this for many months, the individual receptionists are often better at knowing some of the small things that could be done, that could be moved differently. So they may know, for example, the ins and outs of the clinical pharmacist referral scheme that would be appropriate for some patients. And again, one of the things I really stress is the importance for any clinician to listen carefully to what the receptionists have to say. They have become more skilled rather than less skilled over the time they've been working with the clinicians. Next question, how often do the receptionists swap out over the day? Oh, that's a tough question. I would have to ask my team, but I think they would normally do a couple of hours and then have a short tea break, and then they'd have their lunch break. So that's probably a question I would need to go back to my reception services team to ask about that one. Do we have a set script for the receptionists when they answer calls? Well, yes, we start off with a script which they follow, which makes sure we get out the important demographics and gets the patient information rolling. So we would ask, for who's calling, are they calling about themselves or someone else? Make sure we've got the right contact details for them, and then ask what the nature of the problem is on that day. And after that, then often the reception services team will start to go a little bit more freeform and ask questions according to what's come up so far. And they develop their skills as they go through. And as I mentioned in the webinar, we do have a few specific workflows for specific presentations, such as a urinary tract infection. And so again, they have a set of questions that they would ask to any patient presenting with those sorts of symptoms. What's next? Do we have a set number of calls on the triage screen? If so, what do you do with any overflow on the day? Within our practice, we deal with everything on the day. We don't overflow anything to other services unless it's appropriate for that patient to be seen somewhere else. We have a certain number of appointments which are booked on the day. and that flexes according to need, and we regularly revisit that. And as the calls come in, they are booked in for those things that need to be on the day. On the day they're seen, and anything that is filled by the team and there's no longer space within the pre-bookable appointments on that day, then they'll go onto a triage list, and the duty team will deal with those excess calls or face-to-face appointments in the day. And we've generally been able to manage that workload within our team without having to put things over to another day, unless of course it's appropriate to do that and to get the patient some continuity of care with a specific clinician. So that is again one of the main aims of the clinician-led triage system. Do you think eventually you might get to the position where your staff answering the phone can assess the clinical risk and book in with the right member of staff? As I mentioned before, I do think that doing this regularly upskills the reception team so that they're often very good at managing and signposting to a degree the patients that come through. I do think, however, having the clinician there adds a lot of other small benefits that you wouldn't otherwise see. For example, when a patient calls in and they have a problem which could be dealt with within a couple of minutes, or they might need just a prescription issuing, then the doctor will know that and they will be able to sort of put them aside, and having already heard the story, deal with that issue very rapidly from the list which is generated for the duty team to deal with. Whereas if a reception member of staff took that call and then put it into a list to be dealt with later, the clinician dealing with it would have to go into more detail again, looking into the records, and might even need to call the patient back. Whereas if they've heard the story at the first instant and said that they could deal with it with a simple prescription or other intervention, then that means that the person is dealt with straight away and in a more rapid way than having to go back into the notes in great depth. I think that's all of the reception questions for this section. I'll come back in the next video and we'll talk about some of the other questions that came up in the webinar. I hope this is helpful.